Hi everyone, I'm Dr. Daniela. I'm a veterinarian and today's video is going to cover what to expect when your dog is expecting. In other words, how to take care of your pregnant dog. So there are two ways this usually comes about. One way is a planned way and another way is the unplanned way, the oops, the surprise, the I caught her with a neighbor, whatever. But anyways, you get my point. So let's say there is Planned Parenthood for dogs and you take your dog to Planned Parenthood before the pregnancy even happens. You want to plan this. You want to do the best job you possibly can. So in this situation, you want to make sure your dog meets 3 criteria: vaccines, deworming, and blood work. What kind of blood work, you might ask? Well, I'm talking about none other than brucellosis testing. So brucellosis testing tests for a bacteria called Brucella. And this bacteria can cause STIs or sexually transmitted infections in dogs. It can cause females to abort, and the males are typically asymptomatic. So before you let your precious, let's call your dog Fluffy for, just to use her as an example for this video. So before you breed your precious Fluffy with the neighbor dog Bruce from around the block, make sure that Bruce's family provides proof that he is clean. And if Fluffy has bred with a male before, it would be wise to get her tested as well. Moving on to other important topics when it comes to planning and prevention of complications and diseases. I might be looking every once in a while over here. This is where I have my notes. I just want to make sure that I touch on the important topics. I want to provide you with a good quality video. Okay, moving on to other important topics when it comes to planning and prevention of complications and disease. We have flea, tick, and heartworm testing. So it would be ideal if your dog is already on flea, tick, and heartworm prevention prior to breeding. And we wouldn't want Fluffy to come back flea infested after hanging out with Bruce, or vice versa. I'm sure Bruce's family wouldn't appreciate that either. And the thing about fleas is that once you see the fleas in your home, you most likely already have eggs in your home, and those are hard to eliminate. A flea infestation is difficult to eliminate. So if this is a problem, you can always check out my video, how to get rid of fleas. But ultimately, preventing is key. Another reason why preventing fleas is ideal is because once a dog is pregnant, there aren't that many products out there that are safe for pregnant dogs. So it would be ideal to start off by making an appointment with your veterinarian, and you can discuss flea and tick prevention there, nutrition, for example, when to start offering puppy food. And if you already bred your dog before you get to the vet, make sure you write down those breeding dates. You need to breed 2 days back to back, and you write both of those dates down. No skipping of days. So don't breed one day, skip a day, and then breed the 3rd day. That's not ideal. Just 2 days back to back can make our life so much easier, your life so much easier, because then we can narrow down the delivery date, the C-section date. Things to discuss with your veterinarian are the following. Day 28 is when they can perform an ultrasound. Now, an ultrasound is going to check for fetal heartbeats. It is not going to tell you how many puppies your dog is pregnant with. Now, on day 45 to 50, this is when radiographs can be taken, or x-rays, tomato, radiographs, x-rays. Radiographs can tell you how many puppies your dog is expecting. Keep in mind that radiographs are not, how do I explain it? Sometimes they're so helpful, and they can tell you exactly how many puppies are there. You see 4 puppies, you communicate 4 puppies, there are 4 puppies. There's no doubt about it. But other times there is some superimposition overlap when x-rays are taken, because x-rays or radiographs are taken, basically they are 2D. 2D meaning that the body, when x-rayed, it's like they get the body and they compress it. So then you can see overlap. So when there is overlap or superimposition, that's when it can get a little bit hazy, a little bit, there's some room for error, there's some questioning going on. Are there 13 puppies, or are there 14? Are there 7 or are there 8? So keep that in mind, but at least after having done the ultrasound, you'll know if the puppies are alive. You'll have a good idea of how far along she is. You know, she's at least 28 to 30 days. And then with the radiographs, you'll know that she's at least 45 to 50 days, and you'll have a good idea, if not a solid idea, of how many she's expecting. At the hospital, we get plenty of calls from dog owners whose dog is giving birth, but they are not sure if she is done or if she still has a puppy or 2 left inside her. They admit radiographs were not taken, and therefore no one can truly know if there are any puppies left inside. So at that point, we recommend they bring their dog in, which is stressful for everyone, but especially stressful for mom. Mom should be at home resting. She just gave birth to a litter. It would be ideal for her to be nourishing her puppies, bonding with them, but instead she's being taken to the vet. So prevent all that mess and stress simply by taking your dog to the vet to have radiographs performed around day 50, especially if your dog falls under the category of dogs that can have a natural birth at home. So if it's an oops, surprise, aka unplanned pregnancy, then make an appointment with your vet and try to provide the most accurate breeding date, aka the day where you caught your dog breeding if possible. Some people catch it, some people don't, or they simply see the belly starting to grow and she did or was near a male dog at some point, or during a family reunion, people were distracted. So try to provide as much information as you possibly can to your vet. That way you can help them help you. We do have technology these days, and there are certain things can be felt, but information can be very, very helpful during these times. If your dog does not have a vet, then go ahead and find a veterinary hospital that's close to you. Make sure that this isn't an emergency hospital or a specialty hospital. You want more of a regular veterinary clinic where vaccines, dewormings take place, more of where wellness exams are done. That's the term that we use. Also sick pets are seen, usually not after hours, that kind of vet clinic. You want to make sure your dog is established with a veterinary clinic, because she will most likely need veterinary care moving forward. The following are some tips for a successful vet visit. So first of all, make sure you take your dog's vaccine and deworming records to the appointment. And then if your dog is not vaccinated or dewormed, communicate that. You also want to discuss flea, tick, and heartworm preventatives that are safe for dogs during pregnancy, and also discuss nutrition with the vet. For example, you could ask, hey, when should we start introducing puppy kibble? I heard puppy kibble has more calories, more nutrients that are beneficial to a dog that's pregnant, lactating, etc. So you and your vet can find out more or less where your dog is along in her pregnancy by ultrasound and radiographs. So although you might not get the exact breeding date or the exact number of puppies your dog is expected to have, you will be a lot more informed and prepared to assist your dog on this journey and making sure she is as comfortable and well taken care of for her delivery. Remember that not all pregnancies are successful and not all deliveries are successful. And if knowing that is daunting for you, that's understandable. And if you feel like your dog would have a better quality of life by not getting pregnant, then it would be wise to have her spayed. If you want more information on when is the best time to spay your dog, go ahead and check out my video. I think it's called When to Spay and Neuter Your Dog, and you can find more information there. That's it for today's video. If you found this information helpful, go ahead and give it a like, and feel free to subscribe and hit the bell icon in order to be notified of future videos. Remember to keep an open mind. Medicine is ever evolving, and you are the advocate for your pet's health. Thank you for watching. Bye, everyone.